it helps if I press play. I mean, record.
Mm-hmm.
So
I'll bet you haven't even looked at my books yet.
No, I've looked at them.
Mm-hmm. That funny black stuff on the pages is called print.
That's the hard part, you know.
I
reading those, looking at
well,
that
if you
stuff.
feed it to your computer, it might talk to you and
Well, you did give me the audio version.
Read back the most unbelievable stories.
Do you want to tell me a
leave it to you
story?
to decide how much truth there is in them.
I'll have to check. So what do you want to what do you want to say to your fans?
Read my books. If you like vampires, well, there's no vampires there, at least not from the ghost point of view, but there are people. And people can be emotional vampires. They feed off your emotions. They're happiest when they can make you destroy yourself by taking you down. Dream eaters and soul stealers. That was given to me by a professor I had at university. And when he saw that I was in a funk one day, he said, you know, there are two types of very dangerous people that you're going to run into in life. The dream eaters, and those can be your fellow classmates, people around you who tell you that you can't do what you're setting out to do. And they can even be your parents, your relatives, in some cases yourself. If you have a dream, follow it through. If it's not for you, you'll know, but don't let somebody else make the decision for you. And then once you get into your career, and every career, whether it's working at McDonald's or whether it's taking out somebody's appendix, every career has soul stealers. And these are your colleagues, the people working with you and surrounding you, and they feed off your emotional Sturm und Drang. They love to see you unhappy. They pass messages on to you that are in reality false, but they want to see it and they want to get a rise out of you and then make you feel miserable.
Has there been someone in your
Oh,
career?
Absolutely. When I was a senior college student and I had just gotten my notice that I was accepted for medical school, one of my professors came down the hall, looked at me, shook his head, Mr. Comunale, I understand you've been accepted to medical school. And I said, yes, sir. And he kind of put a quirky smile on his face, one of these half sneers, half put down smiles. And he said, I wouldn't go to you if you were a doctor. You don't have the personality. You should go into research. And I said, thank you, doctor. The strange thing was that 5 years later, I was working in the emergency room, and the on-call nurse said that there was a little girl being brought in with a very, very, very bad form of asthma. It's called status asthmaticus, and it can kill a kid very quickly. And back in the dinosaur days when I was a young man, we had very few drugs that were effective against asthma. One was a drug called aminophylline, which, if it didn't solve the problem, usually killed the patient. And just about that time, the injectable cortisone drugs came out, but they were reserved for use by professors and other high-ranking doctors. And I tried all of the things that were considered routine at the time: hydration, oxygen, aminophylline. And the little girl was turning blue, and in status asthmaticus, the person is trying to breathe so hard to get oxygen in, and it can't because the windpipe is shut down. Their neck muscles are tight, their chest muscles along the ribs are retracting and trying to push air inside.
What'd you do?
I went to the medicine cabinet and I took out one of those vials of injectable steroids. And the nurse came running up to me and said, "You can't use that without what was called an attending physician, a professor type doctor." And I just looked at her, then I looked at the girl and I looked back at her. Took a syringe, drew up the medication, piggybacked it into the IV fluids that were going into her. And 15, 20 seconds later, that girl started to pink up. And I know the nurse was just waiting to see the girl die and then be able to report me for being insubordinate and taking drugs and using them that only professors are supposed to use. So the resident who was in charge of pediatric admissions came by, because once you stabilize a patient like that, then they're admitted to the hospital floor for observation, further treatment. And they wheeled the little girl out to take her to the floor. And I was exhausted. I was just wiped my face, washed my hands, and I started to go out through the side door. And all of a sudden I heard the floor nurse talking to this man out inside. And she said, "Dr. So-and-so, I'd like you to meet the doctor that took care of your granddaughter." Who was my professor from college. That was his granddaughter.
Wow.
Very, very strange. And that's how life works. You just never know what's going to happen.